which in the earlier times was something which was just based on the use of a lubricating eye drop, has now something which has evolved into a entirely independent subspecialty. The reason being, all of us spending most of our times on screens. The increased use of screens and devices, the increased population, the increased radiation from so many towers around, and so many other factors have led to remarkable increase in dry eye. Dry eye per se causes symptoms which feel like itchiness, grittiness, foreign body sensation in the eye. The eye feels tired by the end of the day. The vision might get blurred after looking at something for a continued time, and the eyes may also begin to water after some time. Many a times, patient even ask us, the doctor, if I'm suffering from dry eye, then why is my eye watering? It should rather be dry. But the whole point behind watering in such cases is that the eye is irritated and hence it is watering. Dry eye might seem to be something very trivial and a simple disorder of the ocular surface, but it badly affects the quality of the life. And someone might not be able to execute the day-to-day duties properly if the dry eye is not treated well on time. Dry eye is often treated by patients by over-the-counter use of medications, but I would highly suggest that we meet an ophthalmologist, figure out the exact cause of dry eye, and in our case, because there can be multiple causes of dry eye that is leading to a dry surface in a patient, and hence we should get a customized treatment for our specific case and start using the medicine as advised. If the dry eye is treated well on time, if the treatment is taken well on time, then dry eye can be very much controlled. The treatment of dry eye is focused on two things. We have to figure out what is leading to dry eye in our case, and we also have to figure out that what would work as a treatment in our case. So the bottom line here is to understand that we can't just use the treatment of dry eye which our probably colleague might be using. We have to get the dry eye assessed to understand what are the changes we need to make in our lives, and then to understand what is the medicine that should be used for ourselves. Dry eye is something which is involving almost 50% of the current population as per the dry eye intervention studies. And we should all be aware that what can we do to avoid dry eye? What can we do as a precaution to curtail the dry eye before it reaches to a level that it affects our day-to-day life? So it's extremely important that we are mindful towards our daily screen use. I understand that we are digital workers, but I always tell my patients that beyond the necessary use of screen, which is for the bread and butter, please be mindful that you don't unnecessarily keep on looking at the screen. Be very mindful that you are not gazing at the screen when the room is dark, because that puts extra strain on the eye and that leads to further dry eye. Ensure that while you are working on a laptop or on a device, that your eyes are not wide open or they are not facing an air conditioner or a fan directly, so that it leads to dry eye. If you have to work for long hours, if your work commitment requires you to work for long hours, ensure that after every 20-25 minutes, you take a small break of, let's say, 20-30 seconds and look at something which is at distance, so that the eyes get rest. Blink your eyes several times in between and drink plenty amount of water.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.